Hi, this is Kristen Smith at Synergistic Horsemanship, and this is my friend Donna Thran, and she's here to explain to us a little bit about what she does with these horses to help our guys. This is our model Bam Bam here that she's going to be using, and I'll let her get into an introduction with you guys.
Hi. To start off with, what I'm going to do is I'm going to talk a little bit about the way I approach the horse and what I'm expecting to find biomechanically, and what we can do about things that show up that aren't in that particular scan pattern. So I'm going to just use the marker, and I'm going to show you what I'm hoping to see. So the first thing that most riders are looking for is self-carriage. And in order to get self-carriage, the first thing that you need is some lift out of the abdomen up into the loin. Next thing you want to see is the horse working deep under the saddle, across the top of the loin, and into the gluteal muscle, like this. The next thing you want to see in self-carriage is you got the lift, you got the round, and then you want to see the drive. You want to see all three parts of the hamstring. You want to see the semimembranosus, a couple of them, semitendinosus, a couple of them, and the bicep on the outside. If you're really lucky and you see that the horse is coiling those loins and getting down, you'll see that work going all the way to the hock, inside, outside. That's the basis of the scan that I want to see in the hind end. So once you get them in self-carriage, the next thing you're looking for is you want to see that they're beginning to lift here. So if your saddle's working well, you're going to see a lift coming here behind the wither, about that many. Got those shoulders up, looking good. Once they get the shoulders up, instead of being blocked out and swinging their feet forward like that, you'll see that this is freed up and they lift their legs and go forward with them. And so the pattern that you see for that is this. Right about there with nice clean tendons. You want to see anything down there. So if you have a decent hand, and most of the people I work with do, you're going to see how the horse comes onto your hand right here, like this. And the other place that you would expect to see something is how the horse comes onto the bit, right here. C1, C2, and the occiput at the top. And that is the basic of a good biomechanic function scan.
So Donis, can you explain to me a little bit about what the machine is and how it works?
What this scanner does is it looks at the actual impulses in the nervous system. So if there's an increased activity around a certain spot, say a tendon, before it would show up on an ultrasound, you see this increased nerve activity, like if you slammed your finger in the door. Lots of activity around that, and you can catch it ahead of time. It also tells you rider balance, saddle fit, all these things that you can find based on this, looking at how the stand comes up. And it's a very simple thing. It's a resistance kind of thing that the scanner looks at. To go with this, the step 2 part is red light therapy. I use visible red and infrared. I also use random vibrational sound, which is ultrasound basically with a vibration that goes to it. And if I'm working on tendons or ligaments, I like to use magnets because I've read several stories that indicate that instead of the cells filling in a random pattern, that if you use the magnets on those structures, that the cells line up in the magnetic field, which gives you a little bit more flexibility once you get the healing done. So that would be a good cause.
And one of the things that I wanted to bring up too is this does not substitute your veterinarian for diagnostics.
Right.
This is just in addition to.
It's good. It's very good information to be able to relay to your vet that gives them an idea of how the horse is functioning to try and compensate for areas that are showing up that are resistant to any sort of change as you do the treatments, and something stays there. You know that you need to call your vet, because this is body work. It's not diagnostic, and it's not a vet type of treatment. It's just therapy for the feel good. The thing about the scanner is it really just gives you some additional information.
And we were going to talk about as well, I know that there are some instances that you can't use the scanner when you're competing. Can you explain to our viewers a little bit more about that?
The only sport that I know of that doesn't allow this type of treatment, and it isn't the scanner, it's the treatment, is endurance racing. Once you vet it in, you cannot do anything. You can't do ultrasound, you can't do acupuncture, you can't do massage, you can't do any kind of drugs. They're very, very restrictive in endurance racing. But as far as other sports and competition, this fits in really, really well, even in between classes, where you could keep your horse at 100% after every class if you wanted to go that far. So that's the only restriction that I know of.
Okay, great. Well, I think Donis is going to show us how you start a scan.
Oh yeah, I think I will.
Okay.
So I've shown you the basic thing now. What I'm going to do is turn the horse around the other side and see what this horse actually has to show us. Well, definitely got the low side of that one. Okay, so I always start on the left, and I always start at the pole. So this is the ground. That sound is an indicator that I've got something. If the horse is wet, it gives you a false read because you are looking at an electrical system. So here we go. There we go. Okay, here's the hands of the rider. There's the horse coming onto the bit, just like I was thinking it would be. Here's his work in the shoulders. Often you see this when the horse is pulling themselves forward instead of driving from behind. He does have some activity here. Nice. Legs are clean. Easy, big guy. Except for that spot. Go. Okay. So when you start to see this kind of a pattern, you know that you could help the way this saddle is fitting on this horse. And you can see how sensitive he is when you hit those active nerves even lightly. Like you can see, I'm really not putting much pressure on him. You can see that we've got a fair amount of pressure there that we could deal with. Oops, no. Okay, we're not getting that much lift coming into this pressure point, so we're going to move a little bit to the back and see what we've got coming here into the back and over the loin. So when the back is this sore, often what you see, instead of the back rounding up over the saddle, you see pressure here, soreness here, and the strength of the horse going here. And we'll just see if that follows through with this particular scan. Easy, big guy. Easy. Oh no, that's not your happy place. So this is continuing all the way down into the stifle area and through the iliacus here, and here into the flank without really carrying down here like you'd like to see that, as I demonstrated on the other side. So once you get this pattern, very often you don't see anything here in the back. So if he's going to be okay with this, we'll just take a check. All right, so now looking at okay, so we got a little bit of a spasm here in the gluteal area, but certainly not the pattern that I was, once again, what I was talking about. So there's another spasm area that looks like it's trying to get the rear end forward. One. Almost. So that nice low drive here into the top, and you can see we've got a little bit of strain coming here down into the top of these tendons, which will change once you get the pressure off the back. So in looking at this scan, you can see that it's much different than a demonstration pattern that I did on the other side. And as I explained, once you get rid of this area stops being so painful, and you start looking at that nice round lift under the saddle that he's not doing right now, and also giving you the real work in the hamstrings down into the hock. So that's the difference between the scan. It gives you a chance to check that out. So at this point, I can switch over to the the treatment modality that I'm going to choose for this horse.
Okay, Donis, can you explain to us a little bit more about what you're going to do now?
Okay, so this is the session part with the red light therapy, and this is a pad that goes all the way across. I usually use that right here where the bulk of the discomfort is, and I have a couple of pads like this, and I put them forward. They're on-off scenario, and they go like right here, just like that. This is a saturation technique, and I have the random vibrational sound, and this cluster has both infrared and visible red in it, and I use them on these areas. I usually start here like this.
Donis, how long do you usually leave the pads on a spot?
These pads, I just put them on at the beginning of the treatment and just leave them up there. I kind of move them around a little bit. But the best thing about red light therapy is you can do it until the batteries go dead, and there's no known negative effect from having that on there.
And Donis was explaining to us off camera earlier that the therapies can last about an hour.
Yes, especially on a first time trip like that, because there's so many spots, and I address each one of these spots about 30 seconds each. So it can take a little bit of time, and you can see the volume of the number of locations here compared to what I did in the demo. So I'm going to get started, and we're going to do a rescan after I finish so that you can see what kind of changes I'm able to generate with this modality. So talk
Great.
to you in a minute.
Thanks. Thank you, Donis.
If you can see his eye, you can see he's already half asleep. Easy, easy, easy. There you go. There you go.
Good boy, Bammers. And Donis, how do you know when to release from a spot?
It's about 30 seconds when I do these two together. I've been doing it for over 30 years and I kind of got my clock dialed in.
Yeah. I bet you do.
Yeah, but I do have on my double cluster unit, it has a timer
Okay,
that's set for 30 seconds.
cool.
So here we go again. Oh, another thing that's kind of an interesting thing that I do is I try to hit the top and bottom of the muscle to move the energy through the structure. So when I start with the muscles here in the neck, I'm going to start here, which is often where the attachments are when you're looking at this area up here. So the brachiocephalicus, you've got the rhomboids and the trapezius here in the shoulders, the tricep. And so when I do the tricep, I'll be doing this and working down to the body of the muscle and bringing that energy down to the biggest part of the muscle.
Okay, great.
Cool. So
Well, we'll let you get back to work and we'll check your results in a little bit.
perfect.
Okay.
I'll be out here.
Okay, thanks, Donis.
See ya.
Okay, so welcome back, everybody. While we were away, Donis went ahead and treated him, and she also scanned the other side. So she's gonna rescan this side and show us the difference.
Good idea. So use a different color so that we can have a better idea of what we're looking at here.
And you can see Bam's happily eating his lunch.
Yeah. Okay. So basically this was looking really good, so I'm going to focus on this part because that could show us some things that we'd like to know. And his head is down and it makes it a little bit harder to... Okay, now we'll get to the part where if I were thinking about advising her, the owner, to do something that would maybe help this guy feel a little bit better, is I would use the scanner to evaluate a possible adjustment to the way her saddle fits. And when I did this side, I really thought, because this is a very common pattern to come up with for a saddle that needs a little bit of help. And I was thinking, well, that's easy and we'll just fix that, have a method for doing that. But I think that we're going to do a specific course with that in mind.
Yeah, we're gonna do several of our follow-up videos on this as well.
So this is pretty standard. I usually get about 90% resolution. Not always in the hock or attachment areas, but it looks like I did a pretty good job today. But here's the thing that was different that I wasn't expecting. So I'm going to just ask him to step over and we'll look at the other side. Come on. Come on. More, more, more. More. That's a good boy. A little bit more. There you go. There you go. And so now looking at this side, I found something that I could suggest might be a reason why he was having some mild gait anomalies. So starting right here, C1, C2 and the occiput, it goes all the way to the neck, and then you can see this extreme, the entire pectoral area, down into the juncture here where the pectoral muscles come in to move that front leg. And the pectoral is the main muscle of forward movement for the front leg, and so that's something to really think about. So looking at this area, you might remember the other side and the pressure points that were there. This is a little bit more extreme, and I think that it has to do with this being compromised, that her saddle is not fitting in an asymmetrical way, but is in fact just responding to a little bit of compensation because of the pectoral. And you'll notice that this pressure is enough that there's not much activity happening. You can see the old scan that I put there to do the demonstration in the first place. So there's no lift. He's not working that leg. He's got a little bit of activity right here. That often happens when there's pressure here. It stops the full range of motion of the shoulder and puts pressure on the ligaments and tendons in the lower leg. So once you get this out, that usually just disappears. And of course, the compensation for all of this additional activity, you start to see this huge area right here, over the loin and the gluteal and into the hip here, the iliacus, the whole 9 yards, trying to get the rear end to go forward with what he's got compromised in the front. And there's also a line of tension here right along the top of the spine there, and here at the point of the hip. And no, to speak of activity in the hamstrings, and a little bit of activity, I don't know if you can see it in the shade, but here in the front of the hock, where you see the muscles coming down out of the big muscles coming down through the gaskin and into the front of the hock, if that continues to be there, that would be one of the times that I would say call your veterinarian and get that imaged. And it's the same way with anything that I find up over the top. If they stay there and there's a lot of activity, I'll say call your chiropractor. Because with the body being out of alignment, you can work those muscles all day long and you can't really affect a change. So now I'm going to switch gears here, and I'm going to see how much of this, let me see if I got enough in this one to do it. Okay, so we've got the thing turned on. Check it. Working. All right, so the first thing we're going to look at is this pectoral. See how much we were able to resolve. I'll actually use the point of the... So when you start looking at this and deciding that I got about 90% on the other activities, you can see the intensity and what this means to the fluid motion of this horse is I'm only looking at maybe 60 or 70% that I was able to resolve. Coming here up over the top, same kind of thing. I've got this shoulder area, or the back of the scapula here at the top of the wither, or back bottom of the wither. That's looking a little bit better. So looking at how much was resolved here and how much is resolved in the rest of this pattern tells you the intensity at which how much that matters to how much this matters. So I would say that this is primary. This all up here is more secondary, but we're still not getting the kind of clearing on this side that we got on the other side. So I'm thinking maybe 80% on this side with about 50 or 60% on that side. And just sort of this cantilevered activity going on here to try and get that front end off without using the pectorals in the front. And now we'll just take a look at this stuff. That's a maybe. So the further we get away from that shoulder, the better we're doing. And there you go. So let's take a look at this. Okay, so this looks like it's more muscle going this way in attachments than problems going down, because we resolved this whole bottom half, but this whole top half in association with what goes on above it is still there. So that would be my conclusion on that deal. And that is a basic scan, a first trial look at what's going on with the horse. I'd be wanting to do a follow-up, and I'd be wanting to do a saddle fit when this horse started going in a better frame. So
Awesome. Well, thank you so much, Donis. I know one of our viewers also had a question about whether or not this could be used for humans as well.
One of the things, oh, just a minute, I got a little bit of long line here. Whoa. Yeah, as long as you can stand over there and eat and get this, but otherwise you don't. Okay, so one of the things that happened when this company got FDA approval, many of the sports clubs, the football, basketball, soccer, you name it, they all incorporated red light into their physical therapy programs. And they wanted to use this stuff. I personally don't work on people, but it works on dogs, it works on cats, it works on horses, it works on people. The thing about dogs, if you've got a husky kind of dog with a deep hair coat, you can't do the scan. The light still works though.
Okay.
So that's...
But so people can buy their own personal one to use on themselves, is that correct?
Yes.
Okay.
And there's a ton of stuff on the market, and it seems to be very, very effective.
Do you have any companies that you recommend for people?
I do not.
Okay.
I really believe that it's up to the person to do their research.
Okay.
And find the instrument that they're willing to do the level of cost for the level of power that they're going to get.
And if somebody wants to set up a session with you, how can they contact you?
You can just give me a jingle. Actually, a text is best, so I know that it's somebody that's actually wanting to talk to me about a session, at my phone number, which is our area code here, 775-781-0249. And put in your name, and I will give you a text back.
That sounds great.
Thank you.
Well, thank you so much, Donis. And everybody, remember to subscribe to our channel so we can keep doing more videos like this.
I like it.
Thank you.
Bye-bye.
Bye.